So the mandates are back, baby. Well, kind of, sort of, okay. At the nationwide scale, yeah, some of it has been repealed, okay? It's been knocked back a little bit because I guess the coof is scary in some parts of the country, according to federal appeals courts, which, once again, if you put your faith in the fucking, the court system to figure out and do things the right way, you're going to find yourself disappointed more often than not. Court lets Biden's COVID-19 vaccine mandate for healthcare workers take effect in some states after it just got knocked down at the federal level for all the states. Then it gets reimposed in some of the states. What the fuck? Okay, the federal appeals court on Wednesday reversed a nationwide ban on President Joe Biden's COVID-19 vaccine mandate for some 17 million healthcare workers. Okay, the emergency rule, which overrides the injunction that was handed down by another appeals court. This all shit is fucking weird. Okay, it will take effect in 26 states due to a ruling from a 3-judge panel at the Fifth Circuit of the Fifth U.S. Circuit Court of Appeals. Oh, okay. So the federal judge ruled that it was unconstitutional and not really founded in anything, but the appeals court is like, you know what? We kind of like Joe. 2 federal judges last month blocked the mandate. The first ruling applied to just 10 states, and the second expanded the preliminary injunction across the nation. Yeah, but then it just got repealed again, so now it's going to take effect in 26 states as opposed to 10 when it started, and then the entire... This is very confusing. It's almost like they should probably, you know what, hurry up and expedite a ruling on this. That'd be cool. But the appeals court said that it found a little justification for this second move in the opinion by U.S. District Judge Terry Doughty, a Trump nominee, on November 30th. We have to strike this down because Orange Man appointees bad. Doughty's order lacked a constitutional uniformity principle seen in previous cases like Texas v. United States, or concerns outlined in the case and others that patchwork rulings would undermine an injunction limited to certain jurisdictions, they said in a 6-page opinion. Oh, okay, cool. Yeah, no, you can't rule like you have before in the past because we don't want you to. Very fun. The panel that put forth the ruling consisted of Judge Leslie Southwick, a W nominee, James Graves, Jr., an Obama nominee, and Greg Costa, another Obama nominee. So there you go. Really doesn't mean a whole hell of a lot. A neocon and a pair of neolibs. Woo, cool. The mandate issued last month by the Center for Medicare and Medicaid Services covers roughly 17 million workers. It requires facilities that receive Medicare and Medicaid funding to force workers to get vaccinated. It has no testing opt-out. Oh, okay, yeah. Deadline for meeting the mandate is January 4th, unless there's another injunction, unless it gets kicked up to the Supreme Court. But again, Supreme Court and rulings that are favorable to opening up freedoms rather than restricting them ain't fucking likely. The ruling means that the mandate is back in effect for 26 states. It remains blocked under Dougherty's order in Alabama, Arizona, Georgia, Idaho, Indiana, Kentucky, Louisiana, Mississippi, Montana, Oklahoma, Ohio, South Carolina, West Virginia, and Utah. Okay. It remains blocked under separate orders from the United States District Judge Matthew Shelp, a Trump nominee in Alaska, Arkansas, Iowa, Kansas, Missouri, Nebraska, New Hampshire, North Dakota, South Dakota, and Wyoming. Wow, I see the very obvious through line in a bunch of these different rulings. I'm just going to let you guys speculate on that. That's for yourselves to discover and decide for yourself. A preliminary injunction is temporary while a case is resolved. So, okay. So what is this? 3 pre-trial rulings from 3 different courts before some lower court? Because we've already kicked it up to the Fifth Circuit Court of Appeals, because the only court that's higher than that is the Supreme Court. And, so it's going to be ruled by a lower court, or ruled on by a lower court. This shit's fucking weird. Spokesperson for a Utah Attorney General Sean Reyes, a Republican who joined the challenge to the rule, declined to comment on the ruling. CMS did not immediately respond for requests for comment. The agency had last week suspended the enforcement of the mandate, but top officials said that they remained confident they would ultimately prevail against the litigation. Imagine simping for the government so hard that, oh, we need to force these vaccines into our quote unquote heroes' arms in order to, I don't know, be in accordance. It's not really about helping or making sure that the virus doesn't spread anymore, because just take a look at people who are, I don't know, in hospital or even just merely infected, because there's not really enough people to test to see if they have the quote the very scary Omicron variant that are actually in hospital. But whatever. The agency had last week suspended enforcement of the mandate. Yes, the 2 other appeals courts ruled against the Biden administration in similar cases this week. The 8th Circuit U.S. Court of Appeals rebuffed the effort by the administration to lift the injunction entered by Shelp. The 6th Circuit Court of Appeals, meanwhile, on Wednesday, denied the request for the full court to hear the consolidated challenges on the vaccine mandate promulgated by OSHA. Okay, I'll just save everybody the trouble. Less than a majority of the active judges on this court have voted in favor of the initial hearing en bloc. Okay, the court said in the brief filing, the OSHA rule was suspended and blocked nationwide, but then it's been rescinded, sort of, kind of. It's very, very difficult. We'll see where this goes when it eventually gets decided in full court. But as for right now, yeah, New York City is just trying to do their own fucking thing. Anything, any sort of constitution, whether it be United States, New York, or even just the law of the land within New York City proper, all of that's been thrown out, because guess what? We got some details on the specific NYC vaccine mandate, okay? It's going to apply to people, okay? It's going to apply to all public or private sector employees, okay? Unless you work at home. For the time being, even though we're trying to move everybody back into offices that are empty, because that guy in the center of the screen, or at least the one that's right there, has pushed everybody who could, you know what, afford office space in New York City. He's pushed them out of the fucking city, so who's left to be going back to work anyways? Whatever. New York City Mayor Bill de Blasio released more details on his plan to mandate COVID-19 vaccines for workplaces, allowing for religious and medical exemptions, which he's also touted as being, nobody's going to get those exemptions because I am the only true God. Anyways, during a Wednesday news briefing, the Democrat mayor said private sector workers in the city will have to receive at least 1 dose of the COVID-19 vaccine starting December 27th, okay, so next Monday, and have proof of a second dose within 45 days after the first of either the Pfizer or Moderna recipients. Johnson & Johnson requires only 1 shot, and we've seen how good that one has turned out. We saw every single time we put a mandate in place, it was the decisive factor in getting a lot of people to move. It was the decisive factor in keeping people safe, really stemming the tide of new infections. No, okay, it was all about getting people to comply, nothing else. De Blasio, who is stated to leave office in the coming weeks, sayonara, fucker. Now you can go roam the streets, how dangerously you've created them. So I do not expect people to be losing their jobs, because we have found a body of evidence that shows that people make the decision. Oh, okay, cool. It's still a decision, even though you'll be fired if you don't comply. Cool, okay. When it really is the moment of truth to get vaccinated, because I told them to, but it's still a choice. Now, the mandate applies to people who work in person and those who interact with the public for business. You could extrapolate that out to mean literally anybody, okay? The mayor also directed New York City employers to the mayor's website that includes a form affirming their workers have received the vaccines. Fuck off. The form includes the name and address of the businesses, attesting that I affirm that I have read the December 13th, 2021 order of the New York City Commissioner to Health requiring vaccination of workers, and that my workplace is in compliance with the order. During the news conference, de Blasio said that he believes the mandate would spurn more vaccinations in the city, and we've kind of already been over that, and he's a evil man for suggesting as much. But again, he's going to be out of there, and we've seen so far some indication that Eric Adams, the incoming new mayor, he's thinking about going back and revisiting those different mandates and different restrictions. Is this going to be another one of those situations where, okay, the old boss is out and then the new one is in, and then they're just as bad, if not worse? You just see Cuomo and Hochul at the state level for proof of that, but I don't think anybody could be worse than Bill de Blasio, and Eric Adams seems a little bit unassuming, so you hope for the best in that situation. So yeah, I wonder if this is going to happen as well. Okay, doctor says he was fired for trying to treat COVID-19 patients with Ivermectin. Interesting. Okay, because there's been a couple of stories out there that have shown promise. Okay, don't know all the underlying or the mitigating factors when it comes to using horse paste, right? But right now they're just mandating this very safe and very effective vaccine, right? When it comes to alternative methods of trying to keep people safe, you know what, even if they do, like, because the vaccine is so safe and effective at preventing any sort of infections with the disease, or the virus, really, or the case of the sniffles that especially Omicron presents. What if people do get sick, okay? It's supposed to be very effective at helping symptom mitigators. And, oh, Pfizer's got this new pill out there that just lessens hospitalizations and deaths by like 89-90%. It's a miracle drug. But, oh yeah, what about the penny's worth of ivermectin that's out there? Okay, oh no, you can't use any of that because there's no foundation in that. Just ask the people that it's helped before. There's no foundation in it, and there's no studies because of it. And we're not going to do those studies. We'll just save you the time, right? Let's see here. A Mississippi doctor said he was fired for attempting to treat COVID patients with ivermectin, which is approved by the FDA to treat parasites, although the hospital in question said he was not an employee, but instead an independent contractor. A distinction without a fucking difference, dude. If he tried to help a patient at the time when he was at the hospital, like we seen in Illinois, and I understand Illinois and Mississippi aren't the same places, okay? An Illinois private practitioner was trying to help one of his patients who were in hospital, trying to administer ivermectin to help him out with the situation, but he was barred by the hospital for doing as much. But his daughter, okay, the patient's daughter, had to go back to the courts over and over and over again in order to try to make any sort of leeway, which eventually happened. And then he eventually made a recovery. The 80-some-year-old man who came over from Hong Kong. You guys might remember that story. It was a very uplifting story, and I don't get this. I get it, okay, but I don't want to think that we're in the darkest timeline, even though I think that we really are, because this is a very cheap and effective way of helping people out, okay? And like, even just take it out of the context of this, like, let's just say the green Skittles help out with the cancer, okay? Whatever, just throw it out there, okay? Like, why don't people have the right to try, okay? Why don't people have the right to just use a different methodology? Okay, like Steve Jobs, right? He had a very treatable form of cancer, and because he wanted to use crystals and herbs in order to treat his situation, he ended up dying, okay? He had every right to fucking do it, okay? And I have every right to call him stupid for doing as much. But why are we at a crossroads where it's like, no, we need vaccines for literally everything, but what if we want to try this stuff? It looks like it might be showing promise. No. All you need to do is use the vaccine. And it's like, well, how's that going to help when you do catch it, okay? You don't need to think that far. Just get the vaccine. Oh, okay, cool. I see what you're up to. Dr. John Witcher, an emergency room physician at Baptist Memorial Hospital in Yazoo County, well, I guess former, was told not to come back after taking several COVID patients off remdesivir, which approved by the FDA to treat the virus. Oh, okay, cool. And allowed them to use ivermectin. Well, okay, if one, like, you don't even have to talk about the coof, okay? Somebody's not responding to treatment and you take it off of them, okay? Because it's not approved and then you want to try something else because you think, oh, fuck it, what do I got to lose? It's a problem. I was very surprised when I was basically told not to come back at the end of my day. Witcher said in the Stu Peters podcast, these patients were under my direct care, so I felt like taking them off remdesivir and putting them on ivermectin was the right thing to do at the time. Baptist Memorial told news outlet that Witcher no longer practices medicine as an independent physician at the Yazoo City facility. Okay, very appropriate naming there. Adding that he was an independent contractor, not an employee at the facility. So he was still dealing with patients, right? Just a distinction, no difference. The hospital system said that it follows the standards of care recommended by scientific community and experts, such as vaccines and monoclonal antibody treatments. Oh, okay, cool. But again, what if he wants to do, I don't know, what if he wants to use different methods? Oh, okay, cool. That's not fair. That's not fine. But yeah, just to wrap this up to give everybody a refresher course in it, there have been reports of severe coof cases recovering from the disease after taking ivermectin, a relatively inexpensive drug compared to remdesivir. Yeah, a lawyer for the family of 71. Oh, he was 71, not 80-something. Okay, of son Ing told the Epoch Times earlier this month that Ing's life was most definitely saved after taking ivermectin because his condition changed right immediately after he took the drug. Yeah. after he was fighting it off for weeks on end. But yeah, if they let you try alternative methods, this wouldn't be such a fucking problem, but it is. And you just take a look at the different rulings and the different mandates that are out there. And it's not about keeping you healthy. It's not about keeping you safe. It's all about compliance. Take our jabs. Take the dicking from the government that we're handing out for you, because you know what? Hey, it's all about keeping you safe and being safe and effective. It's not about ever getting on the other side of this. So the more you know, the better you can fight back. At least that's what I keep telling myself. With that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.